All right, so some contraindications we have for compression would be heart failure, pulmonary edema, recent or acute DVT, thrombophlebitis or PE, obstructed lymphatic or venous return, severe PAD, acute local skin infection, acute trauma or fracture, arterial revascularization, and significant hyperproteinemia. The precautions we have would be impaired sensation or mentation, uncontrolled hypertension, cancer, stroke, or significant cerebrovascular insufficiency or superficial peripheralization for your nerves. And some of the adverse effects would be aggravating any existing edema or ischemia.
Hello, how are you doing today?
I'm well, how are you?
I'm well. My name is Stephanie. I'm the physical therapist assistant student that's going to be working with you today. Before we start, can I just have you verify your name and date of birth, please?
Yes, Jessica Woodville, November 17, 1992.
All right, let's move on.
Okay, we are going to today apply this compression wrapping on your ankle because you were diagnosed with venous insufficiency disease. And when we do the wrapping, it will help you with the edema is occurring there. Beside the wrapping, you need to elevate your foot up higher than your heart when you get a chance. By the time when we put the wrapping on your ankle, it's going to help you the blood going back to your heart and back to your system, so it can be more efficient blood circulation in your body. But when we do the wrapping, you're going to feel a little bit of the pressure, just a little bit, but it shouldn't feel like a lot of pressure and bothering you too much. It shouldn't feel like it's being suffocation on your ankle. So is that okay if we work with you to put the bandage on your ankle?
Sounds good.
All right, thanks.
Right, hi Jessica. So I'm just going to position you and then I'm going to inspect your skin just to make sure everything's looking great. Right? So what I'm going to have you do is I'm going to have you back up a little bit. So your feet are hanging off good. And then right now I'm just going to remove any jewelry or any items around it so that you don't want to wrap that could cause some trauma as well. Let me just inspect your skin here. For any kind of infection, everything looks good. So we're going to press.
Okay, and then, of course, before we apply the bandage, we would apply some extra padding. If there were any arterial ulcers, we would do the lateral malleolus, but since this is a venous insufficiency, it's the medial malleolus that we would be concerned with. So that's where your extra padding would go on the malleoli, specifically the medial. And we're going to be using a short stretch compression bandage because this patient is ambulatory. This short stretch bandage increases compression upon ambulation.
All right, so now we're going to begin the wrapping. We're going to start wrapping medial side of the foot, the end of the metatarsals here, trying to keep as much pressure as we can towards the foot, and then lessening that as we go up the leg. Going to get a nice base here around the foot, and then avoiding any creases. We're going to start the figure 8 pattern. We're up here at the end. again, making sure there's no creases. Then we're going to take some tape. This would ideally be paper tape. We're going to tape this guy in place so that it does not move. And then we would slide the pants down over top. All right, do you have any questions for us on this compression wrapping?
No, it's good.
All right, we
Thank you.
will see you next session.
The following question, what would we do in case of an adverse effect? If the patient were not present in the clinic or the facility, we would ask them to remove the bandage themselves in case of an adverse effect happening, and we would have them come in to have it reapplied, or we would ask them to go to a professional and have the professional reapply the bandage to their foot.